Hi, Dr. Soloway. How are you? Long time no see. I enjoyed seeing you the other day, and I'm grateful that you were able to give me those injections into my thumbs. They're feeling much better. I have mobility again. It doesn't hurt when I twirl it. And it's like you're a miracle worker because I was racked in pain, and then you helped me. And the drive home with my son was great because I could clench the clutch, with the driving, the steering wheel, so I didn't have any problems. And it's always a pleasure to see you, my friend, and thank you for that. Now, I have some questions for you as a rheumatologist. The main reason that I drive from Long Island to see you is because I think you're one of the best in your field, and I also wanted to keep up the friendship. I always was impressed with you, and I think you're a wonderful doctor and a nice guy, very nice guy. And I appreciate you helping me out now with my arthritis. I also remember many years ago when I used to come to your office to do some accounting work with the CPA firm I used to work for. How I enjoyed the conversations we would have, and I knew from then, and then seeing your waiting room always booked, so crowded. So I knew you were great at what you did, and I'm happy that you're my rheumatologist. Now, I have a couple of questions. My Because I'm aging now and I'm dealing with arthritis, I assume that it's progressive in nature, which means that I'm always going to have to deal with the fact that my arthritis will, over time, probably get worse as I age. Um, that's what I believe, and I'm sure that you can give me some clarification if that's always the case. Plus, I don't believe, but I'm not a doctor, you are, so I defer this to you. But I don't believe personally that there's a cure for arthritis. I'm not sure about that, but that's my belief. And when you take the pain away from my thumbs, it lasts for a while, but eventually the pain comes back. So I don't think there's a cure all. Temporarily relief, yes. Permanent relief, I don't believe so. Um, and also, when you struggle with arthritis over time, is it something that you may need to have addressed surgically? I don't really know how that could be to begin with. But the fact is, when you get older, your bones weaken. And I think that's all part of the whole picture of arthritis. Um, so maybe you can answer that. The other question I have is how come I know some people whose children, young, like in their mid 20s, who have arthritis? I thought arthritis was only um, for, as we get older, our body isn't quite the same and we start to develop aches and pains. I would believe that most everybody who ages at some point in their life will struggle with arthritis. But what is it that causes young people, early 20s, maybe even younger, to develop arthritis? I don't understand that because I always believed that arthritis was an older, mature aged affliction. So I don't understand how young people can have that. Is it something that they are born with eventually that will eventually over time start to present itself? So, that's not related to me personally, but I was just curious in speaking to some of my friends who have young adults who are dealing with arthritis. Also, what is the connection between osteoarthritis, rheumatoid arthritis, and psoriatic arthritis? And does osteoarthritis also um, come into play with osteoporosis? And who's more prone to having arthritis? Males, females, or is it just something that happens basically to all, male or female? It doesn't discriminate. So over time, I will have more questions, but these are the ones that come to mind now. And one other question I have is when you seek treatment on a regular basis, it may be over 3 months, after 3 months, every 3 months, in this case, that I would come to your office, you might have to give me a slight injection or whatever. Um, but is it most likely the scenario that eventually you're going to have to go for physical, uh, what is it called? Physical therapy. Um, and does physical therapy work with arthritis? Um, so these are some questions I have. I will have more, but maybe you can shed some light. If I come up with some ideas that I would like you to address on your YouTube channel, that would be great. I'll even submit some questions that I have on a Facebook post, if that's okay with you. I don't know if you prefer me to message you about it or post it on your Facebook page uh, for you to answer. Um, Thank you, Dr. Soloway, for helping me out the other day. Um, we had a great time. My son sat out in the waiting room, but he was really good. Your staff was very nice to him. And I always enjoy coming and seeing you because not only do you take away the pain I have, but you're also a great doctor with a great bedside manner. And I'm very impressed with you. And I'm grateful to you that you're my rheumatologist and you will always be my rheumatologist. And it's worth the 3 hour drive from Long Island to your office because we're friends and you're my doctor and you'll always be my rheumatologist doctor. Well, anyway, I have to go, but have a great day, my friend, and I'll look forward to your replies. Bye. Bye, bye, bye. Thanks, Dr. Soloway.